Okay, so now that we know some of the terms behind ultrasound, let's talk about what are those effects. So what are the things that we would use ultrasound for and why, okay? So this is the chart from your book that again kind of breaks down. So we're producing those mechanical sound waves. Those sound waves are creating cellular vibration and friction and what we call acoustical or microstreaming and cavitation. We control how much of that happens with our duty cycles. And so if we have a 20%, 25%, 50% duty cycle, we might be targeting kind of more of our non-thermal effects. If we have the 100% duty cycle, our main focus ends up being those thermal effects and what we end up with there, okay? So we're going to go through kind of all of these different effects, but mainly what's happening non-thermally, which happens all the time. So remember, every time the ultrasound's on, we get thermal effects and non-thermal effects. We can manipulate whether we get more non-thermal or more thermal based on our settings. And so our main goal usually with non-thermal is to improve tissue healing and potentially decrease pain. Our thermal effects are usually, the end goals are usually those same things, but we get there through producing heat versus over here where we get a lot of our changes due to those vibrations and what those vibrations do to the cells and to the local circulation in the area. So all these different things happening with the cell membrane, allowing more flow of ions and more blood flow, more nutrient delivery, how it affects the calcium and the way the calcium enters the cells, how it changes the sodium permeability of those cells. All these kind of things that are happening on the cellular level are happening because of these vibrations. If those vibrations are happening significant enough, they'll produce more friction, and that's how we get potentially more of our thermal effects. So again, the non-thermal effects are usually attributed to the individual pulses of that energy and how they cause, again, these terms that we're going to talk about: acoustical streaming, cavitation, and microstreaming. And all those three things are interrelated to produce those effects. And the main purpose being to stimulate the healing process by altering kind of how the cells that have been damaged are functioning. Now, our thermal effects are going to be really similar to the thermal modalities that we talked about when we talked about our superficial heat. So all those things that happen, the increased blood flow, the decreased muscle spasms, the changes in the nerve conduction velocity, changes in cell permeability, changes in the viscosity of the tissue, all of that is going to be happening. Now we're just talking about it happening at a deeper level. So it affects and heats those deeper tissues, but also potentially much smaller, right? Only 2 to 3 times our ERA. And so again, we manipulate this by using our intensity settings and our duty cycles. So pulsed, usually again, 20-25% of a duty cycle. Maybe with like 0.5 watts per centimeter squared. That's going to give us more of our non-thermal effects, whereas our thermal are going to be more 100%. And then we're going to have to be looking at the tissue temperature that we want to reach in order to get the various levels of effects. So we'll talk more about that when we start talking about our parameters. So let's talk thermal effects first, because that's what we're most familiar with. That's what we talked about already in our superficial heat. So the difference being here now that the ultrasound targets deeper, as well as it really selectively heats those collagen-rich tissues. So we really only get the heating in those structures that have a lot of collagen in them, which is usually what we're trying to target. Again, we'll use a chart and some equations, okay, in order to find the desired temp that we want to increase. And then our treatment time is going to be based on the temperature that we're trying to reach. Tendons will heat faster than muscle, again, because they don't have the blood flow, and so the body isn't naturally trying to remove that heat. But some of the effects that we're going to see is increase in collagen extensibility due to decreasing the viscosity of what we call the ground substance, or kind of the matrix of the connective tissue. So they're going to become more stretchy and loose and kind of fluid. We reduce muscle spasm and reduce joint stiffness. We decrease pain due to that increase in the pain threshold of the free nerve endings. We also change the nerve conduction velocity with our heat. We know that. we increase our blood flow, and we get increased metabolism and enzymatic activity. So the cells speed up and they start using more energy and doing things more quickly and increase cell metabolic rate. So again, like we said, we're going to want to target, based on what we want for our patient, different levels of heating. So by far, most of our focus is in usually this moderate heating area. So baseline muscle temp tends to be somewhere between 36 to 37 degrees Celsius. So we're going to talk mainly about raising degrees Celsius just because it's easier and cleaner than talking about Fahrenheit, but you can translate it and your book does that as well. So we get mild heating at about a 1 degree Celsius increase, okay? That accelerates the metabolic rate. We get a decrease in kind of mild inflammation results because of that. Our moderate heating level, 2 to 3 degrees Celsius, we're going to reduce muscle spasms, pain, chronic inflammation. We get that increased blood flow. So a lot of what we would want to do, right, pain control, things like that, happens in this 2 to 3 degrees Celsius increase. And then our vigorous heating happens somewhere between 3 to 4 degrees Celsius increase. And that is when we get this first one, right, the decrease in the viscoelastic properties of collagen, so that those collagens start to relax. So think of someone with like frozen shoulder, right, where they're really tight joint structures. We would want to get vigorous heating in that area so that those tissues start to kind of relax and stretch and mold. And we also, in that time, get what's known as a stretch window. So for about 5 minutes from the end of the heating, end of the treatment, okay, those tissues will remain malleable. And so we would want to actually be using that to do stretching, to do joint mobilizations or traction that we're going to learn later in the semester, and use that heat to help stretch out those tissues so that they return to normal length. Another example would be like Achilles tendonitis. So when you get Achilles tendonitis and you get that really tight Achilles cord, we could be doing ultrasound at the vigorous heating level, and actually while we're doing the ultrasound, keep them on a stretch. So pull them up into dorsiflexion so that as that tissue heats up, it's already being stretched. And then we do that all through the treatment, and then we can do some more aggressive work for, again, about 5 minutes after the treatment as well. Poorly vascularized tissue is going to increase more than highly vascularized because the blood vessels are going to remove the heat. So again, that's the difference between like muscle and tendon. Again, if we have standing waves, we're going to get more heating. So superficial bone is going to heat up faster as well. So we have to take that into account while we think about this too. There is some evidence that preheating with like a hot pack, okay, for about 15 minutes, so doing that superficial heating, can actually allow you to then decrease your ultrasound time by about 2 to 3 minutes if you're trying to do like 1 megahertz to get into muscle or tendon. Because you're already pre-warming the tissue, you can usually cut your treatment time maybe down by 2 or 3 minutes. It's not necessary, but it's something to do if maybe you're strapped for time, that the person can be heating first and then you do the ultrasound treatment. Okay, microstreaming and cavitation. So this is mainly, again, what is producing the non-thermal effects of our ultrasound. It also is what ends up producing our thermal effects, the vibrations, the friction that happens. It's just that those are happening at such high energy levels that friction and heat get released as byproducts. But this is really what we are trying to stimulate in an effective manner when we're trying to do non-thermal ultrasound. So microstreaming or acoustic streaming is this unidirectional flow of fluid and tissue components as it kind of flows over the cell membrane interface, okay? And again, both of these things, microstreaming, acoustical streaming, and cavitation, are all interrelated to each other, okay? And again, if we have them at a high duty cycle, high intensity, these will result in heat, okay? So this unidirectional flow of fluids, okay, and tissue components, soft tissue, across the cell membranes creates these mechanical pressure waves within the treatment area. That alters the cell permeability, the cell membrane permeability to both sodium and the calcium ions, and those are really important in the healing process. So you end up kind of changing how those cells are functioning during the healing process and facilitating the healing. This pressure, also think about it as, sitting in a warm whirlpool, right? When you have the jets on you, it has this analgesic and pain decreasing effect. And so that unidirectional flow of fluid also helps with analgesia and helping with some pain relief. Cavitation are bubbles. Okay, so cavitation is due to the changes in pressure, those peaks and troughs, we get an accumulation of gas, and actually these microscopic bubbles form. When that is happening, okay, and they expand and compress with the pressure changes, when that's happening in a really stable environment, we get these pulsating bubbles that are then going to have these effects on the healing process of the cells as well. Okay, so we get this increased, those bubbles help to increase the microstreaming effect and to do all those things that we just talked about. Unstable cavitation is when we have too much of this energy too quickly. Maybe it's because of standing waves. Maybe it's because we're not moving. So this would be the third reason that we would keep the ultrasound head moving, is to try to not produce unstable cavitation. This is where we get violent excursions in the bubble volume. So they blow up really big and then they completely collapse and pop. And obviously all that pressure change can be really damaging to the cells around it. So it can actually cause tissue damage. So if your temp is too high, or if you leave the head in one place too long, we're more likely to potentially get an unstable cavitation. Now, if the machine is working properly, we should not be at output levels that could cause unstable cavitation, but you just never know. And so again, we want to keep our intensities below our BNR. So we don't want to reach that 8 watts per centimeter squared with our BNR peaks. And then we want to keep the head moving as well. So those eddy currents that form over the cell membranes end up releasing those free-flowing ions and other small molecules that increase the cell permeability. It helps increase local blood pressure, which helps with nutrient delivery, helps increase blood flow. And the amount of the cavitation we get is proportional to the output intensity. Lower intensities at 100% tend to produce more stable cavitation than if we're at really high intensities. And even with high intensities with pulsed can produce potentially less stable cavitation. So we don't get as many bubbles. So sometimes we want to manipulate that as well. So I'm going to pause our conversation here on the non-thermal effects and the effects, because I want you to watch the couple videos that demonstrate cavitation and microstreaming so that you can visualize what's happening on the cell.